All right, welcome back to the deep dive. We're diving into something pretty crucial for all you future nurses out there.
Yeah, absolutely. We're talking about how technology is basically changing the entire landscape of healthcare and what that means for you as nurses and obviously for your patients.
Totally.
Yeah.
So think of this as your crash course in nursing informatics and all these new patient-centered technologies that are popping up everywhere.
We've been going through this really detailed lesson plan on the topic. And our goal here is to sort of distill it down, right? Like, what are the most important things you need to know?
Exactly. Exactly. What are the practical things you can actually use
Yeah.
when you're out there in the field? And what are the key concepts you absolutely have to understand?
Right.
Like, how are all these separate systems, all these digital tools actually coming together?
Yeah.
And how is that impacting patient safety, not just locally, but like literally on a global scale?
And we're going to get into how something as simple as workflow can actually play a huge role in preventing errors.
Right. Who knew, right? So much to unpack here. Yep. But let's kick things off with maybe the most fundamental shift in modern healthcare, and that's the power of connected information. Would you agree?
Absolutely. I mean, the big thing now is integrated data and this concept of interoperability. And I know those sound like really techie terms.
Buzzwords.
Yeah, a little bit, but they have huge implications for how you'll actually practice nursing.
Real world stuff.
Real world, yeah.
Yeah.
So interoperability is basically the ability of different healthcare systems to talk to each other, to share information seamlessly.
Right. So it's like imagine a world where every single hospital had its own language.
Yeah.
And its own way of filing things. Total chaos.
Yeah, exactly. Interoperability is like creating a universal language for healthcare. So information can flow easily between different systems.
Makes sense.
And integrated data is what you get as a result of that. It means a patient's health information is coordinated and accessible across all the different places they might receive care.
Okay, so let's bring this down to earth a little bit. Like, what does this actually look like for you guys as future nurses? I mean, locally, let's say a patient comes into the ER, right?
Yeah.
Because of integrated electronic health records, EHRs, the whole team can instantly see their allergies, their meds, their medical history, everything.
Right. Right at their fingertips. No more hunting down paper charts or relying on a patient who might be, in distress to remember all the details.
Right.
Yeah. Imagine the time saved. And more importantly, think about the potential errors that you can avoid just by having that information readily available.
Totally.
And then if you zoom out a little bit, think about the regional level. We have health information exchanges, HIEs,
Okay.
and these are networks that connect different providers in a specific area. So let's say a patient sees a cardiologist at one clinic and then needs to follow up with, a physical therapist across town. Their information can follow them electronically, which ensures much better continuity of care.
Makes total sense.
And it goes even further than that. Think about a patient who moves to a new city or even a new state, having their treatment history available at their new doctor's office. That's the power of these regional systems.
And it's not even limited to regions, is it? I mean, this is happening on a global scale, too.
Oh, absolutely. I mean, organizations like the WHO, the World Health Organization, they rely on data interoperability to track disease outbreaks, to understand how viruses spread, to develop strategies.
Think back to the pandemic.
Exactly. Sharing data in a standardized way was crucial for every country to respond effectively. It just highlights how interconnected global health really is.
So takeaway here for you future nurses. Think about how much safer, how much more efficient care becomes when everyone has the right information at the right time.
It's all about having that complete picture of the patient's health.
Exactly.
And then knowing what to do with it.
Which brings us to, I think, the next big piece of this puzzle, which is how do we actually use all this information to benefit the individual patient? And that's where clinical decision support systems, or CDSS, come in.
Right, CDSS. These are tools designed to give evidence-based recommendations to both healthcare professionals and to patients right when they need it.
So for you as a nurse, think of CDSS as like your super smart digital assistant. Okay?
Yeah.
It can access this massive database of medical knowledge, and it can give you real-time guidance.
In the moment.
Exactly. One critical example is drug interaction alerts. Let's say you're about to give a medication, and the system flags a potential interaction with another drug the patient is already taking.
That's CDSS stepping in and potentially preventing a serious adverse event.
That's huge, right? It's like having an extra set of eyes, constantly looking out for your patient's safety.
It's a safety net for sure.
Right. And it's not just about avoiding mistakes. CDSS can actually help with early diagnosis too, can it?
Definitely. Now, it's not about replacing clinical judgment, it's about supporting it. So CDSS can analyze patterns in a patient's data. Let's say subtle changes in vital signs over time. And it can alert you to potential problems that you might not have noticed.
Because you're busy,
Yeah.
right, juggling a million things.
Exactly. And sometimes those individual changes might not seem significant on their own, but the system can see the bigger picture, and it can flag those early warning signs.
Right, so it's like having this incredible pattern recognition ability that can pick up on things that a human might miss, especially in a hectic environment.
Precisely. And this can lead to earlier interventions, which, as we know, often translates to better outcomes for the patient.
And it's not just for healthcare professionals, right? CDSS can empower patients directly, too.
Absolutely.
Think about someone with diabetes, for example. The system could send them personalized reminders to check their blood sugar, or it could offer them tailored advice based on their readings.
It's about giving patients the tools to manage their own health more effectively.
Exactly. It's about that partnership between the patient and the healthcare team. So we're seeing this incredible potential of data, right? We have all this connected information. We have systems that can analyze it and provide guidance. But then the question becomes, how do we make sure the actual processes of care are as efficient and safe as possible?
And that's where workflow analysis comes in, which is often overlooked, but it's incredibly important. It's basically looking at how healthcare tasks are actually done in the real world and figuring out how to improve them.
Streamlining, right?
Yeah.
Making things run smoothly.
Exactly. Like, let's map out every single step in a process and see if we can identify any bottlenecks or areas where things tend to go wrong.
Okay, so walk us through that. How would you approach a workflow analysis? Like, what are the steps?
Well, first you have to choose a specific process that you want to analyze. Could be patient admissions or medication administration, anything really.
Got it.
Then you observe and document the current workflow, every single step.
Okay.
Often you'll use these visual process maps to make it clear who's doing what. Then you analyze those steps, looking for inefficiencies, bottlenecks, anything that slows things down or makes errors more likely.
All right.
And once you've identified those problem areas, you can start brainstorming solutions.
Got it. So it could be new technology, or maybe just reorganizing existing processes.
Exactly. Whatever makes the workflow more efficient and less prone to errors.
And it's not just a one-time thing, right? You have to keep monitoring, keep tweaking.
It's an ongoing process. You implement a change, you see if it's working, and you adjust accordingly.
So let's make this really concrete for the nurses listening. Let's talk about medication administration errors.
Big one.
Huge. Still a major concern, right? So imagine a scenario where nurses are spending way too much time just trying to locate medication orders.
Yeah,
Maybe the system is clunky or the interface is confusing.
it happens.
It does, right? That's time taken away from patient care, and it increases the risk of mistakes. So a workflow analysis here might pinpoint that exact issue, all that wasted time searching for orders. And a solution might be something like implementing barcode scanning for medication verification.
Right. Instead of manually checking everything, the nurse can just scan a barcode and instantly verify the right drug, the right dose for the right patient.
Boom. Efficiency and safety all in one.
It's a win-win.
Right. Less errors and more time to focus on the patient.
Exactly.
Now, as you guys navigate all this healthcare tech, you're going to come across different types of digital records. Two big ones are electronic health records, EHRs, and electronic personal health records, EPHRs. It's crucial to know the difference between these.
Absolutely. EHRs are the records that healthcare providers maintain. They're the official documentation of a patient's medical journey within that specific healthcare system. EPHRs, on the other hand, are records that patients themselves control. It's their own personal health information.
So for nurses, EHRs are kind of your bread and butter, right? They give you that centralized view of the patient's medical history. They often integrate with those CDSS systems we were talking about, which help with things like drug interaction alerts.
And they're crucial for coordinating care among different members of the team.
Right. Everyone's on the same page.
And they're the foundation for interoperability, for sharing data between different organizations.
Okay, so lots of advantages. But are there any downsides to EHRs?
Well, they can be time-consuming to use sometimes. especially if the interface isn't intuitive.
Right, you don't want to be stuck clicking through a million screens.
Exactly. And while we're moving towards greater interoperability, there's still a lack of standardization across all the different systems. So you might work in one hospital with a fantastic EHR and then go to another one where the system is totally different and maybe not as user-friendly.
Frustrating, right?
It can be, so it's important to be adaptable.
Okay, so what about those EPHRs? What are the pros and cons there?
The main benefit is patient empowerment. It's about giving them access to their own health information so they can be more involved in managing their health.
I could see that.
But the downside is, if those EPHRs aren't integrated with the official EHRs, it could lead to inconsistencies in the patient's record.
Ah, I see. So it's important for patients to share that information with their providers.
Exactly. And also, the effectiveness of an EPHR really depends on the patient's willingness to use it. Some people are all over it, others not so much.
It's about meeting patients where they are, right?
Hmm.
And understanding their level of comfort with technology.
Absolutely.
It's interesting, right? EHRs are owned and managed by providers.
Hmm.
EPHRs are owned and managed by patients. Totally different purposes.
And different levels of access, too. Providers use EHRs for clinical decision-making. Patients use EPHRs for self-monitoring and personal health management.
It's a key distinction for you guys to keep in mind.
Mm-hmm.
As nurses, you need to be aware of these differences when it comes to things like patient privacy and encouraging patients to be active participants in their care.
It's all connected.
Okay, so we've talked a lot about these digital systems, but we can't forget that at the end of the day, it's people who are interacting with this technology. We have to think about those human-patient interface technologies.
Right. How do people actually use these systems? And are there any safety concerns that we need to be aware of?
Exactly.
I mean, think about all the different interfaces we use in healthcare. Smart infusion pumps, bedside monitoring systems, voice-activated charting, all these things are designed to make care more efficient and accurate.
But there's always the potential for things to go wrong, right?
Absolutely.
Like those smart pumps, incredible accuracy. But if they're programmed incorrectly, it could lead to a medication overdose.
A big safety concern. Nurses need to be really vigilant about that.
Absolutely. And then there's electronic charting, streamlines documentation, but it
Yeah.
can also lead to alert fatigue.
Right. Too many alerts and you start tuning them out. You might miss something important.
And even something like an automated medication dispensing machine. If the interface is confusing, it could delay patients getting their meds.
It's all about considering the human factor. How do people actually interact with this technology?
And how do we design systems that minimize the risk of errors?
Exactly. User-centered design is crucial. We need to understand the needs and capabilities of the people who are actually using these systems.
Makes sense.
And training is essential. Everyone needs to know how to use these technologies safely and effectively.
You guys, as future nurses, will be right on the front lines of all this. So understanding these human factor issues is so important.
It's all about patient safety.
Absolutely. And speaking of technology and nursing, there's this really interesting and growing field that combines those two worlds, nursing informatics.
It's a fascinating field.
It is. So for those of you who love both nursing and technology, this could be a great path.
At its core, nursing informatics is about using technology to improve nursing practice, managing data, improving workflows, enhancing care, all of that.
So what are some of the roles you might see in nursing informatics?
Well, there are clinical informatics nurses who are involved in designing and implementing EHR systems, making sure those systems actually work for the nurses who use them.
Okay.
And there are health IT specialists. They're more on the technical side, making sure the systems are secure and compliant with all the regulations.
Right, really important stuff.
And we have nurse educators who specialize in informatics. They're the ones training the next generation of nurses.
Right.
And with the rise of telehealth, we're seeing more telehealth coordinators. They manage the technology and the workflows for all those virtual visits.
Lots of different options within the field.
Yeah, and it's not just limited to hospitals. You'll find nursing informatics in public health, home health care, research, even policy, anywhere that data and technology are being used to improve health.
So let's recap, Brett. We've covered a lot of ground here.
We have.
Key takeaway. Number one, interconnected data is revolutionizing healthcare. It's improving care at every level.
Local, regional, global, it's all connected.
Right. And CDSS is a huge part of that. It's giving nurses and patients access to evidence-based guidance in real time, right when they need it.
It's a game changer.
Absolutely. And workflow analysis. That's all about making sure those processes of care are efficient and safe.
Identifying bottlenecks, streamlining things, minimizing errors.
Exactly. And we talked about the difference between EHRs and EPHRs. Different purposes, different levels of access.
Important for nurses to understand those differences.
For sure. And we can't forget about the human factor when it comes to technology. User-centered design and training are essential for minimizing risks.
And then we touched on this amazing field of nursing informatics. So many opportunities out there for nurses who are passionate about technology.
So to wrap things up,
Mhm.
as future nurses, you are literally stepping into the future of healthcare, a future where technology plays a vital role.
It's an exciting time
It really is. So think about how you can use these tools to be the best nurses you can be.
to champion patient safety, to advocate for effective technology use.
And what questions do you have about the future of nursing and technology? What are you curious about? That's something to ponder as you continue your journey into this amazing profession.
There's so much to explore.
There really is.
And we're just at the beginning.
Absolutely. All right, that's it for this deep dive. Thanks for joining us.
See you next time.
See ya.